Namaste to all. We are back here today for the second day of the session by our dear Launay scientists. We are in the first class. We have discussed certain aspects of osteopathy with in relationship with cervical pain management. He is continuing the session today. I welcome him on behalf of the all present here. Welcome you. And I'm very glad that we have the doctors who are there on directly present over here. And I'm very glad that Dr. Shayan Mohan, who is doing trigger point release treatment and other physical mental treatments, and has been working to integrate Ayurvedic principles and modern physical medicine principles. He's also here present in person, and that's a great thing as far as the institution is concerned. I think that there is recognition that we have to do something towards propagation of proper scientific medicine, whether it is ancient medicine or modern medicine, in the logical way. And I welcome you, sir. Thank you. Everyone is enthusiastically looking for your class. And I'm also welcoming all those who are offline. And I can understand that some of them are brought ones, students also. So welcome you all for another 2 hours of discussion on how our hands can work to make people feel better and healthy.
Okay, what an introduction. Thank you again, Dr. Sevats, to host me here in Nallepilly. It's a real pleasure to be here. For the second course about osteopathy in cervical pain. So last time on the first course, we've seen some tests and some HVLA techniques together. As an introduction to this course, and in order to allow the people that weren't here for the first course, and in a way to remember better the test we already done, we are going to do again just the test we've seen during the first course. Is one of you able to give me the kind of test we did during the first course? The first test we did, do you remember it?
Bending forward.
Yeah, leaning forward with the patient stood up. So this was a test done with another test. These two tests work in couple. We can separate them. What is the second one? It's quite the same, but it is patient side. So the first test is done with the thumb. You remember that? In order to see if there is an upper thumb and the other. And it's the same with the second test when touching this side. The first test will show us which kind of dysfunction. Do you remember that? Why do we do this kind of tests? And if the first test is more positive than the second one, what is the problem? So it's about sacroiliac, iliac. No, for the first test, it shows the thumb is upper during the first test than in the second one. It shows a problem of iliac, so it can be which part of the iliac, which joint. So, tell me, which joint? Sacroiliacus? or it can be another one. Which one?
Scope.
Now this one. Previous
Same prices.
same prices. So if the first test is positive, it can be all the sacroiliacus, all the previous, but it is a problem of iliac. And if the second test is positive, more positive than the first one, what is it? You said it, coccyx, or mainly sacrum. Sacrum with lack of mobility of the sacrum. Okay. So these were the two first tests. We will do it just after with Ajit. After this test, what was the third test really? Has an English name. So, do you remember the name of this one?
Global test.
It's not really global test. It is the rocking test. So it is side language test, named rocking test, and it is a kind of scan of the spine. So with this test, you will find where are the dysfunctions, but you can't say what kind of dysfunction it is. Just it will show you the vertebrae involved with the dysfunction. Okay. So rocking test on both sides. And after everything, after that, the last test we did. So cervical test. On cervical, we've seen just two tests. It is a simple vision of the cervical, but we've seen just two tests. What were them? Translation and rotation. For rotation, I told you kind of picture to remember how it should react. You remember what is this picture? For the rotation test, it is kind of like a stair.
Recording in progress.
Step by step to the stairs. Okay. On the left and on the right. And when you cross these two tests, translation and rotation, you will find all the dysfunction of the cervix. When I say cervical in this test, it is from C7, C6 until C2. But after for C1 and C0, there are special tests of these areas. Okay. So now with this test, you know how to find the dysfunctions. And now that you know what is the vertebral dysfunction, you will make some moves, some specific tests on this vertebrae in order to see if it is more in flexion, extension, left rotation, right side bending, left side bending, that the move is restricted. Okay? So this is a test more specific. We won't do it today, but it is not that difficult. After that, you will know if this vertebrae is more in dysfunction of flexion or extension, in left side bending or right side bending, or left rotation or right rotation. So we will correct the posture of this technique of this vertebrae with techniques of muscle energy that we will see today. Okay. So what we consider, we have different kinds of techniques in musculoskeletal field. Some are direct, some are indirect. The direct technique, it is, you imagine a child that doesn't want to go to school, for example. That is here. The direct technique is take the hand of the kid and come to school. Okay, this is direct. We go directly to school. Okay, the second technique is you don't want to go to school. Okay, we go far away in this direction. And at the moment, the kid will say, but where are we going? No, I prefer to go to school now. So it was first in the inverse direction, and then we go where we wanted to go. Okay, this is indirect technique. For HVLA or for muscle energy, it will be direct technique. We go directly to school. Okay? So we choose to go directly where is the restriction of movement, the limited movement, and then we will act to have an improvement of resistance. Okay? On cervical vertebrae and on all vertebrae, there are short muscles that can put the vertebrae in a position, for example, left rotation, and there is a spasm of this muscle, and then the patient is not able to do a right rotation because of this spasm. What we are going to do with muscle energy is go on the inverse direction. For example, the patient is going easy on the left, isn't able to go on the right. We'll put it on the right until the limit, and then he will try to turn in the left direction. Turn in the left direction, he will then release, and we will go more on the right, in direction of school. Then again, turn on the left, 6 seconds, relieve, 6 seconds of relief, and then we go on the right. Okay, I'm going to say it again to make it clear. I have a problem of right rotation. I can't do this move, okay? I can easily go on the left, but I can't do this move on the right. What I'm going to do is go past my patient on the right and ask him to go on the left. We go on the left, 6 seconds, relax. And then I will massively put him on the right. Yeah. Until I feel the tension that say to me, it's just here I have to be. I will explain you this just after. And then I ask him to turn on the left, relieve, 6 seconds, on the right, turn on the left, 6 seconds, relieve, and then turn on the right. And after 3 moves like this, we'll retest. And normally it will be correct. If it isn't, we do it a second time, 3 times. Okay? And after this 3 times and 3 times, if it's not better, that means that it isn't a good technique to improve the mobility of the step. There is something else we missed, or we have to use another technique. Okay? So, I told you this with just one parameter in order to be understandable, easily. But we won't do only rotation. We will add some parameters of side bending and flexion and extension. Okay. Okay. Ajit, can you come here? Put the hat off, and you will just lay down here. On your back, head here. No, yes, and head here. Yes, good. I think, yes, if someone can come this camera just here, you will see better. So first, in order to translation. Translation is like this. And it allows you to find a level where translation is not smooth. Second one, to remember, it has to be really smooth, like when you do it with a kind of rhythm. And then second test is rotation test. So you have to use this part of your index, so the radial part of your index, on the posterior part of transversal process. So you do it like this. The other hand on the left side, the right side of the face. Relax, relax, Haji, relax. So this is the test. Here, 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 step by step. Here. Relax. It's completely passive, so the patient has to be relaxed. Yeah, 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 yeah. So at each level, we have to make some degrees more of rotation. If there is 2 steps, just too close, it's like a block you move, that means there is a dysfunction here. So after, even if we don't see it today, we can test easily the mobility in extension like this. So I push with my 2 fingers, my 2 majors in direction of the sail, that way. And after, I don't do that on every vertebrae. I do it on the vertebrae I found in dysfunction. And then I go here in flexion. And I appreciate the move. And I go to the upper vertebrae and I do the same in order to see if the mobility in extension or flexion is limited. Then side bending on the same level. I do a side bending here, another here, and I appreciate the movement. Is there a side bending that is restricted in front of the other one? When I found of these parameters of flexion, extension, side bending, and rotation, I have the whole dysfunction. I know exactly what kind of dysfunction it is. So I can correct it now. For example, if the dysfunction is flexion, left rotation, left side, I will go in extension, right rotation, right side. Okay? So it will be, I will go in extension, right rotation, and right side here. And then I will put my thumb here, just here like this. My forearm will be perpendicular here. And the other hand will be on the right side of his face here, with my thumb in front. And I will ask him to turn left the head with open eyes and with his eyes going also on the left. Okay? So is someone can traduce it in Malayalam because I'm not able to do it.
കണ്ണ് തുറന്നിട്ട്
Turn on the left, open eyes, looking on the left.
കണ്ണ് തുറന്നിട്ട് നീ നീ തന്നെ
And smoothly. Easy.
ആ ഫ്രീ ആയിട്ട് നീ കണ്ണ് തുറന്നിട്ട് മെല്ലെ ലെഫ്റ്റിലേക്ക് നോക്കിയിട്ട് തല മെല്ലെ ലെഫ്റ്റിലേക്ക് ചരിക്കും.
Turn. Yes, it is. 1, 2, 3, 4, 5, 6. Relax.
Relax.
Relax. 1, 2, 3, 4, 5, 6. Relax. Relax. Then he's relaxed. I'm going to seek the new barrier, the new border, new frontier. Okay, I will speak about it just after. I'm on it right now. So I ask him to turn left again with the eyes on the left. Yes. 1, 2, 3, 4, 5, 6. Relax. Relax. 1, 2, 3, 4, 5, 6. And now I'm reaching the new barrier. Okay. Last one on the left. 1, 2, 3, 4, 5, 6. Relax completely. When he relaxes, I don't do nothing. I'm just still. And after, I go on the right and I improve the mobility in right rotation. Okay. So now it's done. I've been to the new barrier, new frontier. It's okay. I can come back passively to the first position. So relax. I do it. Okay. We come here. And then I'm going to test the mobility in order to see if it's better. So I can do it like I did on translation, on rotation, and I can test the movements of flexion and extension and the side bendings. To make it easier for you today, we are just going, when you have found a level of dysfunction with translation and with rotation, you have a dysfunction. We will just test the rotation. We do the rotation and we ask yourself, is it easier in left rotation or right rotation? Okay. If it is easier on the left rotation, we will go on right rotation until the famous barrier. This is the muscular barrier. It means it is the first tension, the first stretch of muscles. We can go further. We can go to an articular barrier, which is much more hard, with more density. This one is the beginning of the stretching of the muscle, and you feel like bend just like this. Okay? When you feel like this, you can go further or you can stay here. When you feel this, you are at the right point. Okay? But if you do this, you are on another barrier. We are not really interested in this barrier for this technique. So when you will feel the muscle stretching, okay, go on. Okay? Do you have any question about it? No? So what I propose you is first to do again the 3 tests we've seen at the first course. It's important to practice and practice again, not to memorize. And secondly, we'll do this muscle techniques. Okay? Let's go. Party. I practice Brazilian Jiu-Jitsu. You know it, no? Brazilian Jiu-Jitsu. No? Yeah. And there is something really, really cool about I discovered in this sport, martial art. When the teacher is teaching a new technique, you can do during 2 minutes, 4 minutes, 5 minutes. It can be a long explanation. So the energy of the group is going down, 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 down. And then after he asks us to practice, but the energy of the group is really down. So what they are doing is saying just after the explanation, we are going to practice now, ready? And they do 1, 2, 3. Yeah, this moment, everyone is clapping. Everyone. And it gives you, wow, more energy to practice, okay? So I do it with my students and friends, so we are going to do it. We have to do it in the same time, okay? Ready? We are going to practice. 1, 2, 3. Now, at the same time, ready? 1, 2, 3. Yes! Come on. So, Ajay is ready to receive, first you are going to do the test, the first test. So, 2 of you, one is practitioner, one is patient, and you do the word test. So, first one, second one, SATs, then you do the working test. Okay? That's good. Ajay, you can come with me. And yes. Is anybody need to see it again? Yes, okay. Come here and with you with your feet, we do. Sometimes. Okay. Yeah. So
Wait, let me come there.
we can remove
I saw down.
this. Wait, no. So here we have a little depression, just here and here. It is globally the area of the sacroiliac. So we are going to analyze a little bit more with the pressure. And we will find a relief here that is the spine, posterior superior spine of the iliac. I don't know how to say it in English, right? But you got it here, you got it here. This part of your thumb is a little bit inner in order to be in contact with the sulcus of the sacrum. So when we are here, the index are here on the crests, and you are going to lean forward.
ഫ്രണ്ടിലേക്ക് വളയടാ.
Go, 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 go. Again. Perfect. Okay. So we see the two thumbs are just similar. There is no thumb other than the other. Okay? Okay. And come back. Okay. To be a little bit more complete about what I do this kind of test also here on C7T1 and here on C0T1. C0C1. So here, I ask the patient just to bend forward the head.
തല മെല്ലെ താത്തണം.
So here, everything is normal. Come back. And then I'm here on the occiput, on the sides here, and I ask the same. Just bend your head forward, just ahead.
തല മെല്ലെ താഴ്ത്താ
The
ചെയ്.
same. Again. Okay, it's the first indication about how we can come back. C0, C1, C7, T1 are working. Okay. So we had this first test that was normal. We are going to see testing on the SAT if the test is normal. So you're going to sit on this table and on this one. And you see, yeah. Okay. Well, join your hands. Yeah. And when I ask you, you will be very encouraged to ground with your fingers. Yeah, perfect.
പറയുമ്പോ ട്ടോ.
Wait a sec.
നീ comfortable.
So here, it is exactly the same, but I'm going to put more pressure inner here in order to be on the sacrum. So Ajay, you can go. and here I have something, my left thumb is upper than the right one. So it might be a problem, a dysfunction of what? Come back. So sacrum or coccyx. So if I have this positive test in my practice with my patient, I will do some specific test of the sacrum in order to confirm the dysfunction. This is just a first overview of how this area works. Okay, so I won't be saying, oh, the problem is this or this right now. Just okay. Maybe I will investigate with more attention this joint because of that. Okay. These were the two first tests. The other one, the working test, is done like this. Here with cycling. So you do it with the column of the foot, all the column, until here. After it will be just this part of it, of the thumb. I'll speak a little bit French. Here it is, for example. Here there is a dysfunction. So mobility here, we can mark it with a pencil.
Pencil. No.
Big one. Yeah. Wow. This is the best. The yellow one? Yeah. Thank you. Relax. Just here is the main dysfunction. So that way, I do more, and you will pass on it, and you will see the difference of density. Okay, come back. And normally, you will do it on the other side, like this. Relax. Here again, here again, here again. There are a group of vertebrae that don't work very well yet. Okay. So this is the rocking test. And the last test, we've seen it, translation and rotation. Okay? So two of you are working together, one inspection, the other is practitioner, and you do the first test, stand up, second one, sat, and then rocking tests, and then here, translation and rotation. Ready? 1, 2, 3. No. 1, 2, 3. Yes. If someone's alone, agile is free. So first stand up. Stand up. Okay. Two. Same person.
Need some water?
Yes. Now, you just put a little pressure on the crest here, and you will follow the move. Okay. I think You are not following, you are doing the move first. So you come back. Rather than do it to this. Yeah. Yeah. Actually, you can. Okay, which is like this. Let's don't make any move. This up, just follow. Okay. So you see your two sum are symmetrical, so the test is negative. You can come back. Sometimes if the patient has back pain, we will ask him to the flexion of the knees in order to protect here the back when it comes back. Okay, no something pressure on the discs. Okay. So now next step is actually something. Then you have to go, yeah. And put your thumb on the sides, just here. Now relax your thumbs and put it like this. Okay. Now you can turn forward. And here we see that your thumb are going down. So you have to follow the move. So come back. You're here. And again, bend forward. And you follow here. Okay? With your hands.
Yes.
It will change everything.
Yes.
If you pull in the wrong direction, you won't have the information. So you have to follow.
The same thing goes.
Yes. And the same thing here. I don't know if you did it on C0, C1. So your half is here a bump. Okay. So you will find it. Then you go laterally and you will be on the angles of the occipital. So you will put your thumb on the angles. That way, if there is asymmetrical move, you will find it easily because there will be a big difference between your thumbs. That's good. You could be more on the sides here. That's a good position. Wow. Can I have a sense? Okay. And follow them. Good. Sometimes with patients it's different. Can we go ahead? Okay. Have you done now the working test? What's your working test? Yes. Begin, yeah. Yes. And look, your left forearm will do that. So there is an action here, and here it's more sensitive with the right hand on you. Okay, it's not pushing hard with the right hand. It's receive the move and how it moves on the level you are testing it. Ajay, relax, relax. Okay. Yeah. There is, I put it here, I relax a little bit Okay, so this forearm is really active. This one is more sensitive. Okay, and I push just a little bit in order to feel the density, but I don't push hard. It's just to receive the information. The sun is as past the spine line. So you have to be here and to be in order to feel the left side of the spine process. Yes. You don't have to pass the river, you keep on the left. Yes.
Just give a pressure.
Yeah, a little pressure.
Okay.
Yes.
Now I can.
And more with side of your thumb more than the thumb like this. Nice. Yes. Yes, much better. Now close your eyes and try to feel where there are more density when you go down. Do it smooth with rhythm. Okay, go further. Okay, so globally we're just here and here. So you found, yeah, it's a difference of density. Good.
ശരിക്കും അത് ഫീൽ ചെയ്യാൻ പറ്റുന്നുണ്ട്. ശരിക്കും അത് ഫീൽ ചെയ്യാൻ പറ്റും. കണ്ണടച്ച് ചെയ്തല്ലേ ഫീൽ ചെയ്യാൻ പറ്റും. കണ്ണടച്ചിട്ട് നീ ചെയ്ത് നോക്ക്. കണ്ണ് തുറക്കണ്ടേ? മാർക്കിങ് കറക്റ്റായിട്ട് ആ മാർക്കിങ്
Crossing the line of spine process.
സർ
For the people don't like it, you can ask the people psychiatry.
ഓക്കെ സർ ഓക്കെ. Launay. Please come.
The more you go down, the more keep the hand here and this hand is smooth, just pushing a little bit. But no, not forcing.
Launay, can you give some instructions to the people who are attending in online?
I show restriction.
For the people who are attending online, can you give some instructions? How to keep the thumb, how to...
Okay. So the first thing is that the thumb is receptive. The action is on the forearm, is doing side bending, and the thumb is receiving the movement.
How to keep the thumb.
And the thumb has to be on the radial part here. So not like this, but like this. And you push on the side of the spinous process, just like this. And you appreciate the movement. Is it with big density? So there is a dysfunction, or is it very smooth and everything is okay?
Okay.
Okay. Okay, so this is too minimalist. Do it with more, a little bit more side bending, and use your whole body to make some move. Like in martial art. You're not just doing like this. Now all the body is doing the movement. So your elbow can be your body here. But quickly with Yeah. Yeah. You have to further and to use all yourself until here. From here to here. Okay. And you will push here. Here. Yes. That's better. Okay. Good for everyone? Okay, now cervical test. So Aji, you can lay down, sleep at here.
തല അവിടെ വെച്ച് കിടന്നു.
And another patient here. And you practice on them. So you remember the two tests you already have seen last time. First one, translation. Second one, rotation with steps, step by step. Okay, let's go. So the position of your finger is good. You're just, you have the scums here. So you are just here and you have to push a little bit here. And now you are just on the apex on the transversal process. So now we can do the move. Yes. And you go like this until C1. C1, the transverse process is more difficult to find. If you want to find a solution to find it easily, you have to put your index on this angle, you know, there is an angle here. Put your index on it. And you put this finger on the mastoid, just here. Then your finger here will be naturally on the good part to find here C1.
അങ്ങനെയാക്കി. Okay.
It will be a little bit more, yeah, you know, here. Often it is sensitive for the patient.
വേദനയുണ്ടോ?
Okay, so you've done everything now. It was to see. Okay, okay. So here there is an angle. You put the index on it. It won't be easy to do on yourself, but here's the angle. You put the index on it. Here is the mastoid. You put this finger on it, and naturally this finger will come here. And you will have here the processes of C1. Okay? Let's do it. Yeah.
ഒരു കൈ മാസ്റ്റോയിലും ഈ വിരല് മാസ്റ്റോയിലും ഇത് ഇവിടുത്തെ ഈ ജോയിലും ഇത് കണ്ടോ? ആ ഒരു കൈ ഇവിടെ ഈ ജോയില്, ഒരു കൈ മാസ്റ്റോയിഡില്, നടുവിലുള്ളത് നടുവിൽ ഓട്ടോമാറ്റിക്കായിട്ട് അവിടെ വരും. മാസ്റ്റോയിഡ് പ്രോസസ് ഇത് അവിടെ വരില്ലേ?
Sometimes you will feel one side bigger or translated, you know. It will be really painful at this moment. Like this, I like this. Yes. Yeah. Now you do this. Yeah. Yeah. Yes. Yeah. And go up. Up. Without rotation. The head. Don't do that. It's just doing. Don't be afraid to push up. If you are in soft tissues, you will all have the information. So you know. So now you've done translation after that.
ചായ സപ്പോർട്ട് ചെയ്യാനായിട്ട്
You know, here there is a scum. Turn and lift the head. Can you ask him to lift?
തല ഒന്ന് പൊക്കടാ ചെയ്
There is a scum. Okay.
Okay.
So you have to be here first, and after you push forward in order to be here in good contact with transverse process. Okay. So put your hands here. Yeah. Relax your hands. You can, yes. Now, you have to be deep enough to feel the water. Just, if you don't mind, I will put my hands on yours and we are going to do it together. This we do this. Okay, so now you have the intensity of the movement. Okay, someone else want my hands on? Can do it together?
ചെയ്യണമെങ്കിൽ ചെയ്തോ he will അല്ല കൂടെ നിന്നിട്ട് ചെയ്യും
No. In 3-4 steps, we have all our surveillance. This one must go down. Yeah, it depends. If you want to miss one, you will here on master it, but it will be with this shoulder.
ഓക്കെ അണ്ടർസ്റ്റുഡ്
This one here. I have the pictures here. And this one here. Okay, and you will find C1. Yeah, will be here. The space between C0 and C1 is short. Okay, now constellation test. Put your fingers here. Relax your hands. And we do it together like this. Once we move, we are going from C6 to C1. But if you want to go step by step, you can go with feeling. Yeah. Okay. So now muscle energy technique. Okay, I'll show you again, and then you are going to do it. So here, For example, your patient comes and he's not able to turn the head on the left. Okay, he's on the right. It's easy for him on the right, but here it's a problem. He can't on the left. So we are going to go with the test to find where is the dysfunction. Then he will go on the left. This is a simplified version of what to do. And now you will put here your index on the transverse process, posterior face, and your thumb here, your thumb here on the masseter. The other hand is just like this on the face, just like this, helping for the rotation. So relax, relax. We are here. I'm going to do a left rotation until I feel the bend, okay, in tension. It's the beginning of the tension. I don't go at the end of the tension, just the beginning. So I'm here, okay, it's fine, it's easy for him, it's not painful. We are at the limit of his left rotation without pain. So now I ask him to turn right and with the eyes turning right too. Okay, let's go, Aji, turn right, eyes open, and with the eyes go on the right. Yes. 1, 2, 3, 4, 5, 6. Relax, 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 relax. Okay. 1, 2, 3, 4, 5, 6. And now we're going a little bit further on the left. Okay. Relax. I do it by myself. And now we turn right again. Okay. And we do it 3 times. Okay. It's clear for everyone?
Yes.
Okay, that's good. Oh, let's go. Let's practice. 1, 2, 3. No, I was here. 1, 2, 3. Yes. Allez, first practitioner. It will be cool to have 2 patients, so everyone can do it. Okay, 1 practitioner here, another one here, and let's go. We are going to say that it's a restriction of left rotation for everyone, or possibly left rotation. So you are going to make a left rotation of his head without side bending. So here you see he's coming here. I would like him to do on rotation. So you will do it in the rotation until you feel that the level you are working on is moving. If it begins to move, you are at the level, so you stop. Okay. And then you are going to feel a little bit with a little bit more rotation, the bend, in tension, where it is. You just stop here, and you will ask him to make a right rotation. The fact is, your index should be a little bit back. Backward. Yes, like this. You will have better grip to use it. So now, stay like this. Now you are going to ask him to look on the right and to have the eyes on the right. Yes. 1, 2, 3, 4, 5, 6. Relax. 6 seconds, doing nothing. And then you are going to turn his head left until you feel the bend in tension. When it is, all the time, it turns right. You are with your shoulder like this? Yes. You have to be relaxed. And your arm will be like this, and look. it will be like this, like here, like this. And there. So you have too much this part of the hand, you have to use this part, like this. So here it is perpendicular to the left, like here. So not here, but here. And your hand is like this. And pull it here. Depression. Yes. Yeah. Relax here. Okay. You are in a good position. Put your hand and you can do it like this. Yes. And my elbow is not here. So, yes. Very good. So now you will turn right. You have to relax your shoulder and to be more like this. Yes. With the stability. So yes, okay. So it has to be some friction without move. If you move the head, it's not a good type of contraction. It is static. So you return. If you don't succeed to maintain his head like it was, you say to him, just go down slowly, okay, without strength. Cool. So he will do it, and it has to be without movement, okay? Isometrical compression. So it's quite good, yes. We will be more stable like this. Six seconds, and after we reach the new frontier with a feeling of tension. And after that, what are you doing? We're finished here. You're doing now. Yes. Now, possibly in the right position. And it's okay. You have space here. See, it will change. Okay. Every time we test after in order to feel the change. I told you about C1. C1 is a little bit more complicated to find, but it is really considered like very important to correct if there is a dysfunction there, because of the relationship between C1 and the germer. I don't know how to say it, germer. It is the tissue that is around the brain and
Meninges.
how do you say? Meninges? Yeah, it is the germer is one of the three meninges. Okay, so we consider that if there is a dysfunction of.
You say dura mater.
Yes, it is dura. Okay. If there is a dysfunction of C1, we create tension on the dura, and it will have a lot of influence of the global motion of the body. So it is a priority to correct C1. Okay. And we often see, I don't know if you will agree, we often see HVLA techniques on C1, but so-called muscle image tech. So starting from the HVLA technique, I managed to find muscle image technique. So if you find a translation of C1, you will find lateral process, transversal process that will be more on the right, for example, and that don't want to go on the left. So we can do it with HVLA and put it here, or you can do it with muscle image technique. I will show you just right now. So we keep the same example. C1 is translated on the right. We are going to do this move, a rotation, a big rotation. Yeah. And we will have here the forearm vertical. And we will make a pressure with this part of my index on the transversal process of C1 here. It can be very sensitive if there is a real dysfunction. So I will come here and I will do a right side bending. Yeah. Relax. It's sensitive. Okay. I'm doing it smooth. Yeah. Relax completely. So this is the HVLA position.
You want
So-
a mic here?
What?
Mic.
Oh, no. There won't be manipulation here. So now I will ask him to make a left side bending, pushing against my hand against the table here. So I'm here. You see my elbow is coming close to my pelvis in order to have a good point here of stability. Okay, it's very sensitive for you. And just like this. So you are going to push on my left hand. Yes, like this. 1, 2, 3, 4, 5, 6. Relax. When he is relaxing, I wait for 6 seconds. Then I'm going to push here with my index on the right process in that direction. And with my left hand, I will have an action of lifts. So I will push here smoothly, gently, and I will lift with my left hand. So there will be an action in both directions here. And then I will ask him to do it again and again and again and again, and I will push in that direction. Okay? And after that, I will test like this. So what is important of this one is doing a good rotation here. All that the patient allows, we take it. And then I will be here like this. I made a side bending and I will push gently in that direction with my index here. And now I do a right side bending with my left hand and I ask him to push in the direction of the table. 6 seconds, 1, 2, 3, 4, 5, 6. Relax, 1, 2, 3, 4, 5, 6. And then we win mobility. Here I push in the direction of the table with my right hand, and with the left hand, I lift in the direction of the table. Do it very smoothly because it can be very sensitive. And here is a really good example of it. If he is really sensitive. Okay, let's do that. You are ready? Yeah. 1, 2, 3. Let's go. In terms of side when the whole like this, if the translation is the left to the right. If the translation is on the right, I will put it with the left rotation and push it on the left. Yes. And after action, we're using the right side. I think I'm raising both sides. Yeah. And I think of the reason to go in the way of the direction. Thus, on this technique, I think it's the only technique where I find that sometimes it doesn't work in this classical direction. So I do it in indirect with muscle energies. That's not the rule. But on C1, it works well. So the first option is this one, classical. If it doesn't work, I'll do it on the other side. I don't know why, but it works on the other side too.
And you also do the sub-occipital at the same time, or
This, yes, and you do this. Yes. But occipital is done with this move on just one joint, and after the other one is made here. Okay, relax. Okay. Okay. So he's ready to have something. So you are in this. This is called the golden point in osteopathy because we use this point very often for.
Can you say it a little louder so that people
No, it's a secret. I can say this part of the joint here is called the golden point because we use it very often on manipulation. So here, just here, we will find some density enough to practice HVLA manipulation. So you will use exactly the same position as for HVLA, but he will use it as some match tech. What is important? It's a detail, but it's important when you do a technique of muscle energy or HVLA. If you reach directly the point you want to reach, and you make the move after, you will move until here on the point you wanted to reach this backward. Okay. So what is important is I don't know how to say it in English. We do in French credit book. That means so if I want to be there, I will go here and I take the skin until here. And after I'm sure that I will be on the right joint, the right bone. Okay. So first I go like this, and then I push on the skin and I come back to be right on the point I want to manipulate. So here you will go here without doing anything, and you keep the skin and you come back here just on the point. And you will see the tissues are relaxed, so it's easier to find the structure. Okay, so now your hand, yes, it was just two like this. I want it to be like this with the golden point on it. Okay, so now your forearm is going like this, and you will lift with your right hand his head in order to do a couple of force. One is going up, the other one is going down. Like this. Look his face, because it's a good indicator of his feeling. Like you will be so like this. You lift a little more. You lift that. This is part of the so we will on action like this. No? You see? Yes. So now you'll go until the barrel, you feel. Okay. Stay here. And now you ask him to push his head against the table. He pushes. Okay. He is making a rotation. It's not a good move. He has to push like this, not to the devices. To smash your hand. Okay, that's better. Do you want to change? It's okay? Okay. It's on the right side. Anyone else? Like this, it will be more comfortable for this here. Yeah. Okay. So now, the aim is just here. You got to be here with this part. Okay. If you put here, when you return, you will be up. So I want you to go backward, press a little bit, and come back here to be right on the good point. Okay. Now, with your right hand, you are going to lift like this, not like this, but like this. Pushing.
Launay explain your brain.
Yeah.
Launay.
I want to spin for you. This part. So you will have to put it like this. Okay, you feel the difference? It's not this part. It's really this part. It's talking about here. Relax it. Okay. You stable when you feel. And now you are going to ask him push the chin of the work now. Push the direction of the taking us around the 6. That's 1, 2, 3, 4, 5, 6. And now you are going a little bit in that direction. And in the same moment, you lift a little bit. So you're doing 16. So it will make a move of translation in C1, not a rotation, just translation like this. Came back. I want you to remember. Yes. That's good. Okay. Do you have any question about it? Okay. So
Briefly on this.
we have 15 minutes.
We have more time.
More time.
Yeah.
Okay. Until
No limits. As much as you can.
take my slides on Friday. Okay. So we are going to, you remember that I told you that sometimes patients have cervical pains, but when we test the cervicals, there is no dysfunction on the cervicals. But the thoracic have dysfunctions. So T2, T3, T4 have to be removed with good mobility in order to have a good mobility of the cervicals. So now that you know how to practice muscular techniques on the cervicals, you have to know how to do it on upper thoracic in order to be able to correct it if there is no problem on cervical or if there are problems on both sides. Okay. So for that, we're gonna work with patient sides. I'm going to do it. We're going to sit here. Okay.
One water. Some water.
Yeah, we're going to get
കുടിച്ചിട്ടോ? No limits.
So you remember we have done the walking test.
No limits.
The test showed some destruction possibly on thoracic. So yes, you can sit here. For example, I do that and I feel that here there is a dysfunction. It is the case for AG, there is a dysfunction right here. Is it a bit painful here? Okay. So what I'm going to do now is to test this vertebrae in order to know what is the great dysfunction. So what I can do first is put my thumb here and to be like in a plane here, watching, and I see that my left thumb come as a plane just as I was just yeah, like this. And like this. So now we can see that my left thumb is posterior and my right is anterior here. So this is an indication. Maybe I will have a left rotation because of that. Okay, but the position is the same. But what is the most important for us is the mobility. If the test of mobility says the opposite of the positional test, we will follow the mobility test. So here we are going to test the mobility of this one. So Aji is going to do a flexion of the head. Go, 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 go. Then extension. Come back. Again, 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 again. Again, 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 again. Again. Okay, and come back. What I feel is that the posteriority here is main when he's in flexions and extension. It is like that, like he likes to be in extension, but he doesn't like to be in flexion. So I will have to restore flexion in this case. Now I'm going to test the rotation. For that, I'm going to take his head like this. It's named turban and then with. Okay, turban is you understand this word? No. It's a piece sorry for my accent. Turban. Turban and then grip. Okay? So relax. 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 Completely relax. Okay. So I'm going to do it like this and to make a rotation. And this cervical rotation will make thoracic rotation too. Okay, at the end of it. So I can do it for the upper thoracic like this. When it is the middle thoracic of the lower thoracic, and I test the mobility in rotation. Okay. After that, I will test the mobility rotation in the other side. So I will know what is the rotation. Level is it restricted on the right or on the left? Okay. So I know if it is flexion or extension. I know if it is right rotation. Now, that's no, you will see. So in this position, I'm comfortable to do side bend too, like this. Okay. So I do the side bend here, and with the sun, like we did in the road test, I appreciate the quality of the mobility. Okay. And then I'm going to do it on the other side. With 3 directions, I will know what is related. Okay, flexion or extension, right rotation, left rotation, right side bend, left side bend. When I got these criteria, I know where the vertebra that's true. Okay. Now we are going to imagine that the vertebrae doesn't want to go in flexion, left rotation, and left side bend. Okay. So now I'm going to put this vertebrae in that direction. So keep with spoon, okay? And after, he will do a move like we did on cervical. It's the other direction. 6 seconds. And it's not 6 seconds. I will go in the direction of the speed. So relax. So he doesn't want to go to flexion. We go first to flexion. Okay. Flexion. Left rotation. Left side bending. Each time I do it until I feel the move on my side. Okay. Flexion, I feel that it is opening between the spinal process of the two vertebrae, the upper one and the one I'm working on. Okay. So here, flexion. Here, rotation. Here, left side bend. Now, I'm going to ask him to do a right rotation of the head. Turn right. 3, 8, 1, 2, 3, 4, 6. That's 1, 2, 3, 4, 5, 6. And I'm going to wing in the direction just a little bit. Left rotation, left side bending. There's no problem. Can begin with side bending or rotation. It's not a problem. And I will do that second time, then the third time. I come back and I'm going to test the move again. Okay. So these are muscle energy technique for upper thoracics. I didn't say to you, but these osteopathic techniques were created by someone named Fred Mitchell. M.I.T.C.H.E.L.L. An American osteopath. And he did all the study about all these kind of techniques. And we are working on the works he did in the past. Okay? So now we are going to do these techniques. Remember, take the turn, hand grip, then flexion, extension, side rotation. You do it on the other side rotation. Okay, you know what is the mobility of the vertebrae. So you will put the vertebrae in the sense it doesn't want to go. Okay, then we ask the reverse rotation. 1, 2, 3, 4, 5, 6. Relax until 6, and then we will in all the positions: flexion, side bending, and rotation. Okay, we are going to work. Ready? 1, 2, 3. Yes. So we can have 3 patients here and 3 practitioners.
Francois, there are some questions.
Okay.
Is translation more on right side, then we ask the patient to turn left side?
Are we speaking of this technique?
No, I think so, right.
It's C1.
Yeah.
The next person on therapy.
So one we do on C1. So if the translation, if the vertebra C1 is translated on the right, we are going to correct it, okay? And to push it on the left. For that, we will ask for a left rotation, and the patient will be on the left. We will push from the right to the left here, and the patient will do a right rotation. No, not a right rotation, but a left side bending, and I will push from the right to the left. Okay, maybe I wasn't clear. I do it again. There is translation on the right. Okay, so mobility is good on the right, but C1 doesn't want to go on the left. Okay, so this part of translation, I will put it up. So I will ask the patient to make a left rotation. So the translation will be up, and I will push on it to make it going on the left. Okay, clear?
Okay, the next question is,
It's not a question, it's an experiment. You can just look at it.
yes. It has been deleted. It's been deleted.
Ah, okay, so waiting for the question. You are working 3 patients, 3 practitioners, and we do the test with the children and with.
ഏതാ ഒരു
So you have to be a little bit on the sides. Yeah. Yes, more on the side. Yeah. Now, my right hand will be here, and my left hand is going here, and just on my elbow there is the front head. Yeah, and my hand is going on the opposite. Yes. Be careful with the nose of your patient. Don't smash the nose. So now we are going to choose T2, for example, just here. I just at before this test, we have done the positional test. Okay, we consider that it is done. So now we are going to experiment the move or T2. So we are going. We can put our hand like this with fingers here in the space between the spinous process of T1 and T2. There is a space. And then you can put your major here in the space between T2 and T3. Okay. So now we are going to make a flexion. Yeah. Do we feel that it is opening everywhere? Making extension? Do we feel that it is closing everywhere the same way? If it is a yes, there's no dysfunction in flexion or extension. If there is a difference between both moves, there will be or dysfunction of flexion or dysfunction of extension. Now, we are doing a rotation. So let's rotation here. And we appreciate here the mobility. Is it okay? Is it smooth? Then normally we are going on the right. We will do it, but we have to do it together because if we don't, we won't have enough space. And here, like this, I do a right rotation. Is it okay? Is it smooth? If it is not, I have the respective mobility about rotation. Now I can do for side bending that way. It could be that way or that way. And I feel how it goes on the level and testing. After that, I come back here and do it here like this. So first flexion, extension, rotation both sides, then side bending both sides. And I will know exactly what is the restriction of move of the vertebrae. So I will act the opposite. Well, I will act to go to the restriction and ask the patient to go to this. So to be 100% clear, if it doesn't want to go in flexion, in left rotation and left side bending, I will go in this direction like this, until feeling the barrier, muscular barrier, I told you. And then I will ask him to do a right rotation, resist to it, and gain, win in all the parameters we've seen. Action, rotation, left rotation, like that. Okay? So you have to practice in mirror because you will rather each other, same sides. Wasn't so long for KRT. This one, if you want, you can check.
After manipulating on right side, left side of the head felt heavy. And after manipulating the left side, the right side felt heavy. The side on which it's manipulated feels light, but other side gets heavy. So what could I have done wrong?
So this person is doing the techniques on patient right now. This is it. Okay. The feeling of heaviness is not a problem. If he has done in the right way, will relax the muscles of the area. So maybe the person will feel relaxed and like a little bit heavy. So that's not the main problem for me. But maybe I misunderstand the meaning of heaviness. If it's just relax and feel that the head is heavy, it's not problem for me. If it's a sensation of heaviness on the move, that's different. This is just a small part of a big puzzle. And for example, on thoracics, there are the ribs articulated, and we will have to check the ribs too. But I can show everything just for hours. So sometimes the fact that a rib is in dysfunction can create a little conflict when you correct on the thoracic. Okay, but with this kind of technique, it's very smooth, so we don't have any risk of losing for the patient. If it's discomfortable, it will be during 2 hours and after it will be okay. So no need to worry about it. It's good techniques. Okay. When you have this, so if you want to test flexion extension, you will appreciate this space. Then you ask for flexion, and you ask yourself, is it available to say in the different levels or not? Yes. Okay. Now extension. Is it closing exactly the same? Okay. So if there is a no in your answers, we will know that there is a restriction or infection. After that, we will make a rotation. The pro rotation, I think it's better to do like this. It will fit well. So you make a rotation. Rotation is normal. When you do a rotation, say the muscles have it has to be pure rotation, but you are making something now. If you do a mixed move, it would be harder to feel the dysfunction. So when it is rotation, it's pure rotation, it's not with something. After first rotation, then side bending. If you are at ease, you can do on the same side on the rotation side bending, and after the side, if you are, rotation of the leg, rotation of the leg, then seconding of the leg, seconding of the leg.
Very much.
Yes. This part is quite difficult to release by yourself, on yourself, Cervicals, you can manipulate it a little bit, but upper thoracics, it's very hard. So these simple techniques can release the patient because by himself, he's not able to live.
Francois, Dr. Hema has asked, can you explain thoracic manipulation again? It was also clear.
Okay.
The one we are practicing right now.
Okay, so in muscle energy.
Yes.
Okay. So what we are going to do is restore the mobility. With the test, we found a lack of mobility restriction. We know if it is flexion or extension, left or right side bending, left or right rotation. So now that you know that, you know what are the parameters restricted. So you will go in these parameters. For example, we will change. It is extension, right rotation, right side bending. Okay. So during your test, you found that. So you are going to go in extension, right rotation, right side bending with the turban handle grip, and you will ask patient to go on the left. Turn on the left. He will turn without moving. It is an isometrical contraction. 1, 2, 3, 4, 5, 6. Release. Not moving during 6 seconds. And then you will go in extension, right rotation, right side bend. Okay, until you feel the new tension on the muscles, and then you will ask for a new left rotation. Okay, is it clear for you? Yeah, I hope it is for this doctor. Okay, guys, we've seen this technique of muscle energy. That's cool. I wanted to show you other techniques, skin techniques, but we won't have enough time to show you all these techniques, skin techniques. But I can do just show you, but we won't practice it. We don't have enough time for it. These skin techniques are done. It's called skin reflex stretching, and it is done on several points, as you have normal points. Some of these points have been noticed, and you have to follow this. For the cervical pains, I'm going to show you some of them. So we are going to read
Secondary.
First, I'm going to show you the kind of movement we do. So you have to put a bit of pressure on the skin and to make circles. 1, 2, 3 circles in order to relax all the tissues. Then you will stretch the skin in a direction and count 1, 2, 3. And then you will do a quick move on the other direction like this and maintain the stretch 1, 2, 3. Okay, so I show you. It is 1, 2, stretch. Okay, so you will have to find the good pressure in order to stay in contact with the skin and to not, I don't know what's the term, skip. I don't know, slip, yeah. So you will have to stay in contact with the skin here and no finger. Okay. So for cervical, it's just a part of what we do, but we are going For example, if the patient is not able to turn left. We've done all our manipulation I show you, and at the end, he's not able to turn left. Okay, that's the problem. We are going to use this technique in order to fix it. So if it is on the left here, I will ask him to put his left hand under his left button.
കൈ എടുത്തിട്ട് ബാക്കിലേക്ക് വെക്കണം.
And yeah, under your button. Yeah, you see on it. And the palm has to be down.
കൈ താഴെ.
The right hand will be on his leg, like this. Relax, 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 relax. Yes, good. So there would be here an internal rotation and here an external rotation. Okay. Now he's not able to go on the left. Now I will ask him to be on the left, but without pain, just at the border of the pain, basically. Okay, or the pain of the restriction of movement. Then I will make him some pulse here. So as I've done here, like this, I will do it with my thumb here on the spine. Okay, if you want. I'm going to do it between my thumb and my index here. And each time my other hand is in front. Okay, if I'm working here, my other hand will be here. If I work upper, my other hand will be just in front. Okay. So here, I'm going to do from here to here, staying with the left rotation. Okay. So here, I'm going to do that. Stay with left rotation. Yes. Okay. So from here to here. Now I'm going to do it on this way until here. But it's not easy to do it like this. So I will use this part of my index and I will put like a 0 here in contact of the skin. My left hand is forward and I'm doing this. It's powerful. It's powerful. No? After that, hip rotation. I'm doing here on the scapula elevator.
Elevator scapula.
Elevator scapulae. 3 times. Then here on the supraspinatus. Then here on the lateral side of the scapula. There is a word I don't find, but you understand what I mean. And after, like this. So I've done here, I've done here, 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 here. Okay. So after that, I will take his arm here and do it here in the armpit. So I will do that 1, 2, tract, and come back. Without sleeping, I stay in contact with the skin. 1, 2, I go here, I tract. 1, 2, 1, 2. Okay, it's done. Normally, it stays with left rotation. Okay, your hand, where it was, is here. Okay. So now, here on the cervicals, I will do it here, 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 here. Okay. On this side, I'm going to do the same, exactly the same, with left rotation. So I will do it like this. Here, tack, 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 tack. Here, tack, 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 tack. Here with the armpit. Okay. And after that, here, I will do it here. Okay. After I've done, as you've seen, just here on the occipital, and then you're going to see it in front. I'm coming here. 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 And I do the same thing. Relax. Okay. And it's down. I do it here. On the sternum. So you keep the left rotation. My hand is coming here on the thoracic, upper thoracic. And I do this. 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 And after that, I will do it again here, here, here. Just to show you again, here, 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 and that's done. Okay, comes back, yeah. And then I will ask right rotation, then left rotation. Okay, and normally it is improved. So we have worked on musculoskeletal band, and here it's more on fascias, tissues, and what is really important for this technique is to feel the vibration on the points. This is why we do it slowly. 1, 2, 1, 2, 3, boom. You feel, when you do it correctly, you feel, boom, the vibration in the body of the patient and in yours. It needs to be really focused on what you do. If you seem to another thing, not work the same way. Okay? So there are different techniques like this, but what I show you is mainly from a technique, a French technique called Niromathé. And it is said that Niromathé is coming at the beginning from India. Well, so pleased to show you techniques from India. What is the name of the technique? Niromathé. Niromathé. Yeah. So maybe we'll have time to work on different kind of technique like this next time. With this kind of vibration, we could work also on single points with inhibition points that are really interesting for cervical pains. I thank you for your attention for these two courses. Wish you the best for what is coming soon, and see you to the next time. Bye-bye.
Any questions?
What?
Okay.
There is a question from here on online. Will be happy to answer.
Any question?
I think it was a classic session. The way, again, I tell that he is a good teacher. He makes you understand the thing and make you do it and have hands on. Now, as you told, we are missing, we have got an introduction into this and we have more to learn from the practical answers of some of the methods you do, but one of the latest long therapy and so many applied things which can be done into. And I take this opportunity to thank on behalf of the organization, Svasthyakshetram Ayurvedic Healthcare Center. And I also thank the opportunity given by the Medical Association of India by providing the Zoom platform for this. And it is a very heartening thing to see that people come, they join together and help you to learn. I was here just for a treatment last year also. We were there. Last year it was a small group which we did. And this time we have gone. And this has opened up an opportunity where I don't think that we will wait for everyone to come over here and then again start next year. But we'll have a planned series of Zoom classes right from France. And we will be here. And once we come back next time, we will have a 2 or 3 day offline session right to those who have aspirations. So I think it is it was a wonderful opportunity for all of us. Thank you once again. And I would like to have the feedback from the doctors who are here, as well as the opinion from Dr. Shine Mohan. Please welcome, sir. Because he is, I appreciate his interest and enthusiasm of driving some 80 kilometers away just for meeting in this class in person. And here we have a person who is into this subject, like me into Burma and interpretation of Burma, and you have all the other interpreters. And I think the Ayurveda Medical Association have been always working for the progress of the science, integration of the science. As in the beginning session, I told it is almost 14 years back we did a session on osteopathy on Spinal in Palakkad. So I welcome Dr. Shine Mohan, please thank. And because you have some of your students also online. Comes at you.
Thank you so much, sir. It's also an honor to hear it from Dr. Srivas. And I think, like everybody else, even I was very happy and really enjoyed the 2 sessions, even though it was very short. But I think there was a lot of takeaways for many doctors. There are a lot of junior doctors are just doing their probably internship or just finished their course and they're here under training. So the hands-on treatments, the way your enthusiasm and we really enjoyed it. Thank you so much. And I attended the first one online, so I really wanted to meet you. So I'm really happy I was able to meet you. And I think and as he was teaching us many things, I mean, he taught us something that was in India. That's from India, right? So that's how deep and how well medical system was practiced sometime in India or in the ancient days, right? And somehow we have lost that connection. And the only way to get back that connection is actually trying to explore different techniques. And and the best example is Srivatsar. He's retired and he's still studying. And that is the biggest attitude anybody can have. And sir's interest and mine is interacting with him. That is the takeaway what every doctor should have. That we don't know anything. Right? Right when you finish your PG, right when you finish your DMS, right when you finish your PG, the first thing you should tell yourself is, I don't know anything. And the more you try to learn about the human body, you understand how less you know. So that learning attitude is what we have to develop, and then rest will come in place. That's what I feel. That's been my journey, and I'm happy to meet you. And there's interact with sir as well. So I really enjoyed the session, and thank you for this opportunity, sir. Really, sir's enthusiasm to share whatever we know. It's evident. I think everybody should come and have a look at this place, and then the effort he's taken to build this place. It's like a Muscular system, and the libraries here, the books here. He's converted his old house into a nice, like a Muscular stay where everybody can come and learn. So thank you so much for that also. Thank you again. It's a good privilege.
It's just, I believe that sometimes we have to modernize without leaving the tenets of Ayurveda. So that's the connect I'm making. Not to forget the old, but not to forget to become modern. In thinking, in application. I would like to have Dr. Garima, can you give some of your feelings? Dr. Garima from Surat. She had her graduation from college in Bangalore.
Thank you so much for giving this opportunity, sir. I would like to say that first thing, I really don't know much about these things. I was learning, I am learning. And after your class, I started learning new things, how to fit that tension. And once you put your hand on that, once you try, then only we can understand. So it's more about feeling and understanding the human body, how to do the manipulations, and how we can understand what is wrong in our body. I would like to give to Dr. Geetanjali for her statement. First of all, I thank all for the beautiful classes, and the classes was very interesting. And second, I thank Srivatsar and Anil for giving such wonderful classes. And we was there for 14 days, and I felt like we could start this class before it. And today, I really felt it was too late. Anyway, I thank you so much. Next, I would like to call Luspita. Thanks a lot for conducting this awesome workshop on osteopathy and physiotherapy in cervical pain. Yes, we knew about oral medications and culture material, but we had a little idea about physiotherapy. And thank you so much, sir, for giving us a hands-on training on how to do manipulation and everything. Thank you, sir.
I think surely those who are on online in this class would like to give some comments, but I don't know technically whether it is possible. I thank all of you who have been with us in this session. And Dr. Maya, are you going to respond? Maya, is having this one.
Thank you so much for the wonderful sessions. We are very see so we are grateful for the current and the for the I will
Sir.
Thank you. I think time is also running out, and then it's time for the speaker, and it cannot be just all a speech because of the class. And he has put a lot of effort for us. That effortless effort is called because it is there all in the mind. Then you know that we understand the future. I would like to call Dr. Anirudh to tell a few words. Dr. Anirudh is the secretary of the Ayurvedic Medical Association Chittur area and have been instrumental in arranging things and organizing things along with the doctors here. I would like to, he is the assistant medical officer here and have been having a lot of experience, exposure to all such things. So I invite him to say a few words and then join along with us to tell steps. Speak today.
So I'd like to thank Francois Launay. As we all said, it was very short but more informative.
He's a good patient as well as a patient teacher.
The way you explained, the way you try to make us understand everything was really appreciable. And we'd like to thank you once again for this session. It was a very good session. We're going to thank Dr. In moment for attending the session for coming here by traveling 80 plus kilometers. Thank you everyone for attending this.
You want to come over here? Sorry. You can come here. You can join in the presentation. You do it.
Yeah.
This picture will be there.
What is this?
It's all mixed information. Yeah, put a good. This is a calendar made by Dr. Vasishthan Group for the as an almanac. Every writer should know what is the date, time, and the star, and this one.
Thank you very much.
So, and someone might have some this is a small token of small token of love. And I'll hold this for you.
So you can do it, it's okay.
Is a lamp which always suggests that lighted lamp is actually we give it lighted and hang it over. This time convenient to sit here doing it in this way. Please accept it and that you are knowledge as the lamp shows the light well all over. Happiness of man, so the feeling. Thank you very much. I do. Looks like a coffee. Thank you very much. Thank you. Yeah, I'll sit. Yeah. So we shall end up this session with the good belief that Launay is going to give us sessions So we'll have his session, we will make an arrangement so that we will be not missing him until next year, but in between we will be meeting with him in the I think he will be cooperating with the discussion. So we'll end up with the level of Thank you, everyone. We will see you again. Goodbye. Give him a customary clap that he taught us. No? That's 1, 2, 3. Perfect.